Good afternoon, Brandon West. Let's begin the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence I chose nursing as my career.
Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence I choose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals, therefore I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession and changes happen daily. Nowadays technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in present days a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there so they can help me during my initial days.
Your preparation time is over. Please start your OET speaking role play.
Thank you for your cooperation, Mihiraa. From the basic examination, I understand you've been having some difficulty with your hearing, and I'd like to help you with that. First, I'd like to ask you a few questions to better understand your situation. After that, we can discuss possible causes and ways to manage it. Does that sound okay to you?
Of course, Brandon, that's fine. I've been struggling with my hearing for a while now, and it's starting to affect my daily life. I'm really worried about it.
I completely understand how concerning this must be for you, Mihiraa. Let's start by gathering some details about your hearing difficulties. Can you tell me the relevant information about the hearing loss?
Sure, I first noticed it about 6 months ago. It started gradually. I had trouble hearing people in noisy places, like restaurants or family gatherings. It hasn't happened before, but it seems to be getting worse afterward.
Thank you for sharing that. Have you been exposed to loud noises, either at work or in your daily life?
I used to work in a factory where there was a lot of machinery noise, but I retired 5 years ago.
Mihiraa, could you tell me how you have managed this so far?
I haven't had any ear pain, but sometimes my ears feel a bit blocked, like there's pressure inside. And I haven't tried anything yet. I thought it might just be part of getting older, but now I'm not so sure.
That's helpful to know, Mihiraa. Now, let's talk a bit about your general health. It would be helpful for me to understand your general health.
Well, I haven't had any infections recently, but I do sometimes get a lot of earwax. I've had my ears cleaned a few times in the past. As for medications, I started taking blood pressure tablets about a year ago, but that's it.
Thank you for sharing that, Mihiraa. Based on what you've told me, there are a few possible causes for your hearing loss that we can consider. Firstly, it could be age-related hearing loss, which is quite common as we get older. This type of hearing loss tends to develop gradually and often affects the ability to hear higher-pitched sounds or conversations in noisy environments. Secondly, your previous exposure to loud noises, such as in your factory job, could have contributed to the issue over time. Prolonged exposure to loud sounds can damage the delicate structures in the ear, leading to hearing difficulties later in life. Additionally, the blocked feeling you've described might be due to earwax buildup, which can interfere with hearing if it becomes impacted. Lastly, underlying health conditions, such as high blood pressure, can sometimes affect hearing as well. Since you mentioned you're on medication for blood pressure, it's worth exploring whether this could be playing a role. Mihiraa, would you like to add any further information to what we've discussed so far?
No, that's it. I think the age-related part makes sense, and the earwax buildup might be part of it too. I didn't realize my blood pressure could affect my hearing.
It's good that we're identifying these factors. Mihiraa, at this stage, it's likely that age-related hearing loss or earwax buildup is causing your difficulties. It's important to know that age-related hearing loss, also known as presbycusis, is a common condition that affects many people as they get older. Additionally, earwax buildup can also contribute to hearing difficulties. Taking care of your ears is crucial in preventing further issues. Protecting your ears from loud noises, such as using earplugs in noisy environments, can help preserve your hearing. Maintaining good ear hygiene by gently cleaning your ears and avoiding the use of cotton swabs or other objects inside your ear canal can also make a big difference.
That makes sense. I'll try to be more careful.
That's a great start, Mihiraa. I understand that managing hearing loss can be challenging, but there are several ways to help you navigate through this. One of the most effective solutions is using hearing aids, which can greatly improve your ability to hear and communicate. Avoiding loud environments is also important to protect your hearing from further damage. Regular ear checkups with a healthcare professional can help monitor your condition and ensure that any issues are addressed promptly. Also, I strongly recommend making an appointment with your doctor for a full hearing test. This will help identify the extent of your hearing loss and rule out any underlying causes. Your doctor can provide personalized advice and explore other treatment options that may be suitable for you.
Thank you, Brandon. I'll definitely book an appointment with my doctor and look into hearing aids. I appreciate your help.
You're very welcome, Mihiraa. I'm glad we could discuss this today. If you have any more questions or need further assistance, please don't hesitate to reach out. Take care.